Hi everyone, here we are with Desiree. Desiree is, she's 30 years old and she came mainly for a lower back pain and a pain on the knee, but she also has multiple pain and she suffers from a chronic, we can call fatigue, right? Yeah. At 17, she's been diagnosed with a borderline rheumatoid arthritis, and before that, when she was young, she had one main injury. She broke a couple of toes on the left foot. Then she's been diagnosed at 17 with the rheumatoid arthritis. They did an operation on the lymph node of the face, and she also removed the tonsil. The lymph node, because they thought probably they could help the condition. Was it successful? Or
technically, they think that it worked, but for many years I still have the fatigues and I still have the joint pains. So I'm sure that they've done something good, because since then I've been much better than what it was, but still not 100% recovered.
Okay. Also, 8 years ago, she had an operation on the knee because she was suffering a lot, specifically on the left knee. She had an operation, an arthroscopy, but also they drilled the femur because they saw no cartilage on the knee left, and they thought by drilling the femur there would be a better exchange in between the blood and the fluid inside the knee. That left lots of pain because the knee is still very, very painful. That's the main condition that she has, but also she suffers from this chronic fatigue, which is very annoying. Now I will show you what I usually do on a patient on average. I check everywhere. Can you please remove your glasses? I usually check from the head to the coccyx. So I'm like that. I wait to feel something. I already checked before, so I already know the skull doesn't have much. So what I feel a kind of a torsion. If there is a movement that is low, that is quite wide, I already know the head itself doesn't have a lot of injury. I just check the lower part because lots of people remove teeth and they have some little restriction, but more or less the jaw moves well, okay? When we come to the neck, if I move the neck toward the left and toward the right, yeah, it's painful. Okay, it's painful, but also it's more stiff left to right. Now, it's not written anywhere, but it seems that the lumbar spine and the neck are very in a strict connection. So whatever happened on the lumbar spine, there is a lot that is happening on the lumbar spine, is reproduced on the neck. So there is a restriction on the left side flexion. I try to move the shoulder down. There is not a big restriction here. There is just on the middle part of the neck. Now, the middle part of the lumbar spine is the area where there is the innervation of the knee. She had a massive operation on the knee, so I expect the lumbar spine, left side, not to move at all. In fact, not only doesn't move, but it's also quite painful. So I come here, I grab the lumbar spine, and I just pull it left to right, okay? This part doesn't move at all. If I go on the other side, right to left, it will move a lot better. I can do a lot of tests. I can try to move the pelvis right to left, and left to right, it doesn't move. Yeah, it doesn't work at all. So this side doesn't work at all. This side is completely different, okay? I don't know if you can see, there is a little bit of a twist here. You can physically see the body is not straight at all. When we go to the leg, this part is extremely hard. A test that I always do for the knee is this one. It's very simple. You grab the femur and the tibia, you grab them, and then you twist the knee, one side and the opposite. So if I do on this one, which is the, let's say, the good one, I twist this way and I twist the other way. More or less it's similar. More or less it's similar. If I do it here, if I do this way moves, and the other way is completely, and it's painful. It's painful and it's stuck. So you grab the knee and you do 1 and 2. One way it will be completely stuck. Now, she had a big injury on the toes. Hard to believe, but the toes will affect the sacrum immediately. The pelvis will twist and the leg, it won't work anymore as before. So a pain on the knee. If she came to me 8 years ago, before the operation, I would probably have a look on the foot. Now the foot doesn't look like the main things, because if I go to the sacrum, the operation on the knee is the sacrum moves a lot more than the lumbar spine. So it means that for the body of the patient, the knee is a way bigger problem now. Because not only there's been this inflammation for a long time that caused pain, but also she had an operation. And the operation is the trauma now. And the operation is quite extended. So it's not a typical arthroscopy, but it involved a big area of the femur, okay? So if I try to extend, there are limitations. She has an hypermobility, so the knee extends a lot. This one, anyway, extends less than the other one. There are a lot of tenderness around here, and this one is different. This part is more interesting because there is the innervation of the foot around the sacrum and on the lumbar spine of the knee. So this part, it will never bend. So she will never bend on the left, the pelvis anymore, unless we treat it. Okay? So at the moment, I try to forget about the rheumatoid arthritis, all this value that she's been going to blood test. How many times? Once a year?
Probably twice a year.
Twice a year, and they always confirm this borderline level for rheumatoid arthritis. At the moment, I try to forget about it. I can do tests everywhere. The spine, more or less, in other area, it works, it bends. This part is the one that will need the treatment. So I already know I need to treat the left knee from the spine. So the spine tells me where is the goal. To improve the left side flexion of the area around L3, third lumbar spine. I will do it. I will open the camera again, and we will see if there is a different here. So this movement needs to be more equal. Okay. So the treatment lasted more or less 40 minutes. I treat the knee. The knee was part of an injury that she had a long time before. She lost the cartilage, and then she had an operation. So definitely there was a big injury. It's been quite hard to treat it. It took longer than usual, but the operation was quite extended. Now, I do the test again, twist this way and the opposite way. I don't expect that she won't have pain, okay? The pain, it will probably be... Okay. You feel that a little bit of difference than before?
Oh yeah, it's moving.
Okay. The most important was the pelvis and the lumbar spine. So yeah, just relax. This is the mobility of the pelvis. Yeah, do you feel the difference?
Oh yeah, it was completely stuck before.
Okay. This is the mobility of the pelvis, and this is the other one. And then the lumbar spine. Just relax. So the lumbar spine moves this way a lot more. And because the lumbar spine is connected with the neck, this is a confirmation. Okay? So the neck, left side, left to right, it bends a lot more. So I treated the knee, all the other part of the body I kept untouched. Yeah? I didn't do anything anywhere else. So now moves a lot more on the neck as well, despite the fact that I didn't touch the neck at all. This tells me something changed. There is a systemic change, so it means that the body changed everywhere. So if I have tested 20 joints and took a note of how they were moving before, now they will move more. Okay, the shoulder, the elbow, the wrist, every single joint. But it is important to do few at distance from the treated area, because they have any way to change. In fact, here there is an improved left side flexion of the neck. I'm happy with this. We will wait a week, and then we will see in a week time. We will collect the feedback, and we'll see if there is any proper change in terms of pain, and hopefully in terms of fatigue. Okay, that will be the top. Thanks for watching.
Thank you.